Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to this episode of the Gastro Girl podcast. This episode on leaky gut syndrome is brought to you in collaboration with the American College of Gastroenterology's Patient Care Committee. And today we're joined by the wonderful Dr. Tricia Pasricha, who is a gastroenterologist at Beth Israel Deaconess Medical Center in Massachusetts. And she's also an instructor of medicine at Harvard Medical School. Welcome, doctor. How are you doing today?
I'm doing great. I'm really excited to be here. Thanks for having me.
Oh, we're so excited to have you. So leaky gut, we've gotten so much misinformation. Patients are confused. Is this a thing? Is this a myth? So we hope you can cut through all the noise out there and really help us understand what leaky gut syndrome is, if it is something, and what we need to know about it. So let's just jump right in.
Yeah, leaky gut it's a great topic. It's one that I think a lot of people just in the general public know about, and then it fills a lot of doctors with fear for some reason when it comes up because doctors don't really know what that term means, and so I think it stems from just a little bit of confusion about the semantics, about the terminology, right? So I think you meet three different kinds of doctors. You meet doctors who have heard of this term leaky gut and are like, wait, that's not a thing, that doesn't exist. Can we not talk about this? You meet some people who have never heard of it and they're like, that also isn't a thing. It's like totally like there's no science behind leaky gut. But then you meet this third kind of doctor, which is what I hope I am, which is the neurogastroenterologist, or people who study intestinal permeability. And we know it's a thing. That is a thing. And yet we're like, but let's make sure we're not confusing what people think leaky gut is with this thing called increased intestinal permeability. And so whenever my patients bring up leaky gut, I always like to frame things in terms of what we know, what the science tells us about increased intestinal permeability, which is a very real thing, affects me, affects you, affects everyone here.
I love this. So I guess we'll start with the question. What is leaky gut syndrome and how does it affect the digestive health system?
Yeah, so leaky gut, and I know this a lot from my work as I'm a columnist for the Washington Post, and I get a lot of reader questions who ask about leaky gut, and I get my patients talking about it at clinic. So, but you'll never come across that term leaky gut in like a medical textbook per se. And so I've watched lots of social media videos trying to understand what it is that people think leaky gut is, and I think what leaky gut has taken on the meaning of is this idea that the kind of tight junctions in our intestine are open. They become open through a number of different reasons. It's not totally clear, always what people think causes it. And then that so-called leakiness is what's responsible for, quote, toxins entering the body. And those, quote, toxins are what causes a number of different symptoms kind of attributed to leaky gut. And in terms of what you see on social media, things like brain fog, bloating, malaise, dyspepsia, stomach pain. And I like to I think that's what people think leaky gut is and leaky gut syndrome is. And there are a lot of different remedies that you'll hear about on social media for leaky gut. Maybe it's a probiotic, maybe it's some kind of nutritional supplement that will help close those junctions. And you can really go down this rabbit hole of like what we're trying to cure and what the root cause really is. And you just kind of get further and further detached from the science. So I like to focus in on just coming back to the basics. So let's just talk about intestinal permeability. So, and this is just how our physiology works in all of us. Our intestine are made of these really tightly joined epithelial cells that in health and in disease sometimes open up those gaps. So I think of it like a picketed fence, right? And so sometimes those gaps in the picket open up a little bit. And if you have a real yard, animals, other things can come in and out. But if those pickets are really, really tight together, nothing's coming through. But lots of things in real life, whether you have a disease or not, cause those junctions or those pickets to open up. Infections can make them open up. Stress makes them open up. And certainly there's different diseases that are associated with increased gaps in those pickets of our intestine and things like celiac disease, irritable bowel disease, even sort of unexpected diseases, perhaps like Parkinson's disease, which is something I study very closely and the possible GI origins of it. But the problem is that a lot of these diseases and what we know about that association with increased intestinal permeability is that it's an association. And I think this is where sometimes there's a little bit of a misconception about what it all means, is that we don't know what it means. We don't know Is it the irritable bowel syndrome that caused increased intestinal permeability, which some may call leaky gut, or is it the other way around? We don't know that yet for a lot of diseases. And so it's hard to say what we need to be treating is the leaky gut, when maybe what we really need to be treating is the underlying disease process. And that's what I fear most with what's happening a little bit online and in this kind of popular conversation, is that we focus a lot on this phenomena that may or may not be really the underlying disease inciting pathology. I sometimes compare it to, it's like talking about, I have an elevated white blood cell count. I need to treat that. My white blood cell count is what's causing it. And often the white blood cell count, it's a problem, but it's actually just a sign. It's a clue telling us there's something else going on. Is it an infection? Is it an inflammatory process? And we really need to understand what the heart of that is.
Yeah, no, I love that you're, taking us back and with the intestinal permeability, because that makes so much sense. And to patients, coming from the patient perspective. So what are some of the symptoms and signs or people may be experiencing that they may say, oh, I think I have leaky gut? Like, I want you to focus also along with the intestinal permeability issue. Like, what would be some of the symptoms that people are experiencing that could lead them down that path and trying to think, oh, do I have leaky gut?
Yeah, and that's exactly right. I mean, most of the symptoms are these really common GI symptoms like bloating, like abdominal pain, and maybe, sometimes people start to confuse a little bit of like this whole separate conversation about food allergies and what that means, but maybe we'll say food sensitivities. Having a lot of those, they say, is it because I have leaky gut, because all of these things in the environment and what I'm putting into my body, they're causing those types of symptoms. And those are GI specific, but even things like just feeling like you have low energy and brain fog, people attribute to leaky gut. And the confusing thing about that is that all of those symptoms, the GI specific ones, and maybe the kind of more general ones like the malaise and the low energy, all of those can be caused by known GI diseases. Celiac disease is well known to have complications like brain fog. Irritable bowel syndrome classically has associated with bloating, constipation, not feeling well. And so it's important to try to figure out what is the underlying cause here when you have all these symptoms, and just stopping at, well, it must be leaky gut is actually maybe selling yourself a little short, because you're not getting to that underlying physiology. And once we know what that is, and sometimes the only way to know that is to talk to a doctor, get some more tests. Then we can treat it. We can treat it accordingly. A lot of my patients, they'll have seen on social media that they'll be like, well, I know I have leaky gut because this influencer or this like really gorgeous doctor on social media said, you have leaky gut if you have X, Y, and Z symptoms, right? And, the tricky thing is that if we're talking about an increased intestinal permeability, there really is not a good clinical test for it. That doesn't mean we don't know how to test for it. We do, and we have in research settings. We can get biopsies from the gastrointestinal mucosa and put them in these kind of fancy machines called Ussing chambers that measure permeability. But these are not things that we do, unfortunately, yet in a clinical setting, and that's mainly because, like I said, just diagnosing leaky gut is usually not the answer. We need to figure out how to treat you. It's sort of something that is associated with a lot of different diseases. So
it's almost like its own symptom. Like you have this, and I like intestinal permeability. You have this as a result of something. What is causing this intestinal permeability in your body? And that's what you're trying to get to?
Yeah, that's exactly right. Is that all of us have increased intestinal permeability from time to time. And if somebody's really worried, and I'm certainly not telling you that I think having increased intestinal permeability is always healthy, always a good thing. It's something that does happen in times of stress, which happens to us all. But it is associated with certain diseases, and we're trying to understand what that means. But if somebody's particularly worried about this and want to kind of reduce their risk of harm to their gut, there are a couple of practical things I tell people that are really well associated, well studied, to increase intestinal permeability in a way that is not healthy, right? Like, no matter how you slice it, these are things you could change that will benefit your health. And so those things are ultra processed and high fat foods. So we know through numerous studies that typical Western diet increases your intestinal permeability. It more than doubles the amount of bacterial toxins in the blood, which we think is a result of those kind of tighter junctions opening up. And it often has to do with kind of what is coming into the process of making foods, which is like emulsifiers, which are common food additives that kind of prolong shelf life, artificial sweeteners. All of those things can not only increase intestinal permeability, which is that in and of itself so profound? Maybe, but it's also been recently well associated to increase your risk of symptoms in irritable bowel syndrome. And that's something that we certainly know is a major entity that we can treat, and we have specific ways of treating. I tell people to reduce their stress because psychological stress, like I mentioned, it's an important modulator of intestinal permeability. Okay, and you're like, oh, how do I wish we could all reduce our stress. I wish I had some magical formula for that. And I don't necessarily have that. But we do have lots of different tools in the clinic that we offer. But there's a really nice study from Belgium, from the lab of Jan Tak, who's done a lot of the work in intestinal permeability and the brain-gut axis. And so there's a really well-known study where he basically looked at college students who had to give this oral exam, this oral presentation in order to graduate. And he measured their intestinal permeability before and after, and the stress of it. And he was able to show that it was due to stress hormones that increased right before they had to give this exam.
So how do they measure your intestinal is there something you look at? Like, is it like how do you do that?
You're asking the right questions. There's a number of different ways to measure intestinal permeability. And again, none of this is ready for the prime time. These are tests that we do on the research setting.
Good. But that's good to know in the research setting, because I think it's important to showcase to patients that there's no clear-cut answer a lot of times, and a lot of things are still being researched. We've learned so much just in the last 10 years about the brain-gut connection, the gut-brain connection. And that's, there's actual solid evidence. Before it was like, hypothesized, maybe not quite. And there are actually interventions that target that connection. So I love that even though you may not be using it in clinic setting right now, it's coming. It shows that it's something that's being looked at and it's a viable area of research.
Yeah, that's absolutely right. There's a couple of different ways. And one of them is we would get a biopsy of your gut. Like we could do that endoscopically. We get a biopsy of the mucosa, and then we can look at that microscopically and kind of stimulate them electrically and just see what the permeability looks like at the tissue. Sometimes we do these tests where we basically look at solutes in the urine. We have you eat some food and or a certain type of substance, and we see how much of that substance ends up in your bloodstream, meaning how much is getting absorbed through those junctions, which may or may not be leaky. The more that gets absorbed, the more that ultimately makes it out into your urine. Some of these tests are, they have pros and cons to them, and they have to be done in a very, very specific protocol with a lot of specialized tools. So that's why they haven't yet made it to the point that we're just testing the average kind of person who walks in with symptoms yet. But I would argue too that I don't know, we might get there in the future, and it would be great if we did. I don't know today that I need that information for my patients, because at the moment, I find out somebody has increased intestinal permeability, or they don't, their symptoms are still what they are. And I still want to understand what's driving the symptoms, which may or may not have anything to do with their increased permeability. And we have lots of tests that we can do to look for some of the other common causes of those symptoms. For example, I've had people come in who have just had fatigue and malaise and thinking maybe this is due to increased permeability. And actually the whole time we're talking about anemia, and they had a low blood count, which is a totally separate process. And it's one of those things that you can really miss a bigger picture if you really hone in on something on social media describing these symptoms that are pretty common to us all and can have a lot of different etiologies.
I'm glad you mentioned that. They're common. They're pretty common, and I think we're so wanting instant answers and explanations for why we're feeling some way, and then we want an instant solution. So it's so quick to see some attractive influencer saying, "I have leaky gut and I tried this and now I feel better." While we wish it was true, a lot of times it's not true, and it sends our patients and people just down a path, and they're still not getting the right treatment. Like you said, this could be an anemia, and a patient wouldn't know that. So if I was a patient and I came to your office and I went online and I said, I have leaky gut and what can I do? What would you say to me? What would you say?
I would say, first of all, it's very possible you have a leaky gut. And so I wouldn't dismiss that at all. I would tell them exactly what I've told you about how leaky gut in and of itself is a difficult thing to diagnose, but that what I know is real and is valid right now are the symptoms you're feeling, the symptoms you're experiencing. And let's try to figure out what's driving those symptoms. Some of the things that drive those symptoms also drive increased intestinal permeability. So we should try those interventions, and we can see if that helps fix it. And so those are things, like I mentioned, cutting down your ultra processed foods, not taking NSAIDs. So NSAIDs are like ibuprofen, Motrin, Aleve, Excedrin. Those things are well known to damage the lining of our guts. Alcohol intake, recent studies, we used to say for a long time, well, the upper limit of alcohol intake should be no more than 2 drinks per day for men, 1 drink per day for women. But the recent studies have shown that there probably is no real safe, healthy amount of alcohol for anybody. So the more you cut that down, the more you limit it, the better. And there's lots of data. In fact, probably if we're talking about mechanisms, probably the most convincing data for what increased intestinal permeability can do, the damage it can do to your body, is through some of the studies we've done on alcohol and ultra-processed foods. By those types of irritants and toxins, when those increase intestinal permeability, it hits the liver, and there's kind of a strong link with some of the data we have about the risk of what used to be called fatty liver disease or steatohepatitis, and now MASLD. So cutting down alcohol, I think, is a very strong, safe thing to recommend to anybody with these symptoms, and certainly it will decrease the risk of intestinal permeability. So, and then the other thing I tell people to do is to increase the fiber in their diet, right? So the fiber we eat gets fermented by our gut microbiota, and that can produce short chain fatty acids like butyrate. And butyrate has been well studied in the world of intestinal permeability, and butyrate can help rebuild those broken pickets in our gut fence, and it's kind of also associated with reduced intestinal inflammation. So those interventions, reducing stress, stopping alcohol, increasing fiber, those are kind of healthy lifestyle recommendations I would give anybody. But and it sounds very simple. Truth be told, none of us really do all those things all the time. If you did, I applaud you. But sometimes going back to the basics and really trying to do those things can help with all of those symptoms and does decrease that risk. If doing those things is not solving the problem, it may not. It could actually just be that we're focusing on the wrong thing, and that's okay. We need to start looking at what else is driving those symptoms, and that's when we start to do other kinds of tests to look at other systemic diseases or maybe even gut-specific diseases, inflammatory bowel disease, celiac disease, other things that could be causing these symptoms that we just may be overlooking because it's a little bit easier to say, aha, this is leaky gut. It fits that description I've read about leaky gut, which it does, but that itself isn't a diagnosis, and it isn't always something that treats what's driving the problem.
Now, have you seen patients that come to your office and they're like, I have leaky gut, and then they try these interventions and you actually discovered it was something else? Can you give an example, like someone was diagnosed with another GI or other condition that they originally thought, oh, I have leaky gut?
Yes. I mean, I am kind of it's unfortunate to say that I see this a lot. Like I see a lot of people who sort of self-diagnose as leaky gut, and they'll try things at home. Some of them are backed by science, like the things I mentioned, like increasing your fiber, minimizing your alcohol. That's more science-backed. They'll try things sometimes that the science is weaker, like, certain probiotics, certain supplements, which the data is like not that clear on. And they come to you after months and months of trying these things. There's a subset where they start eating a really clean whole foods diet and they feel better. And that's wonderful when that happens. And it's also not surprising because irritable bowel syndrome, which we know the symptoms are exacerbated by ultra processed foods and these kinds of added emulsifiers, those are worse. Maybe that's what they had the whole time. And they did a great thing by treating themselves by not doing that. There are a lot of people who try all these things and they don't get better, or try, what they've read about online and they don't get better. And I think I've had couple of cases now of patients who have actually had celiac disease, and that, they had just bad bloating. They felt like no matter what they ate, it was sensitive, and they hadn't quite narrowed down that it was a gluten problem. They hadn't quite narrowed down that, once you have celiac disease, it's not as simple as cutting out gluten. You have to do that's part of the treatment, but you also need to start getting monitored and tested more frequently. You have to kind of look at your family members, get them tested. It becomes like a more involved healthcare discussion that we don't want years to go by that we're missing and we're not checking your thyroid levels and we're not making sure your sisters and brothers have been tested and also making those right changes. So that's to me the biggest fear about any, not just leaky gut, but any kind of medical diagnosis you make online about yourself is that you might be right. You might even make an intervention that helps you, which would be really great. But what if you're missing something bigger going on and we're missing an opportunity to halt disease progression?
Oh, those are excellent points. And I hope our patients really have a better understanding that leaky gut syndrome exists, but also within the context of this intestinal permeability that you described, which is so important to understand. And I want to just close out the episode with, do you have some tips for patients, especially about and some guidance about self-diagnosis and treatment, the cons of that?
Yeah, what I don't want to happen is for anyone to get so caught up in self-treating a so-called leaky gut that we misdiagnosing an underlying disease, right? And if you're suffering, I want you to feel comfortable enough to tell your doctor all of your symptoms, right? Like sometimes in the GI world, we're like a little embarrassed to talk about constipation or bloating and things like this. And it's made even worse when you get a doctor who tells you, oh, everything you're talking about, that's not real, right? Like leaky gut's not real, or, oh, bloating's not a big deal. Like that's awful. And that makes people feel like it's coming to their doctor's not a safe space. And so if you ever encounter a doctor like that, I want you to find another doctor, and I want you to find someone who you can feel comfortable telling your symptoms to, because these are real symptoms and they really cause a problem in our quality of life. But find somebody who can kind of help you together methodically examine the whole picture to get you feeling your best. Don't just stop at this idea of leaky gut for which we don't have a test, when we do have tests for the diseases that may be driving or related to the leaky gut, and we have a lot of targeted treatments for those diseases. And so I think that's the big picture, is that when you diagnose yourself and you treat yourself, you could be really missing an important big picture that a healthcare provider that you trust, that you have a good relationship with, could help you in.
Well, thank you so much for joining us today. This has been so interesting and hopefully educational and helpful to our listeners today. And maybe we'll have you on again if you're up for it another time. This has been a great conversation, and I really appreciate your time today.
I'd love to come back. Thanks for talking to patients about this.
Thank you so much.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.